Normal sleep patterns. There are 5 sleep stages. The cycle through 5 stages in 1 to 2 hours. Individuals vary in time spent in stages. The older adults will awaken during the night, and there is a need for restoration and repair, and most would require 7 to 9 hours a night. Now, sleep is a natural state of rest during which muscle movements and awareness of the surroundings diminish. Now, sleep will restore energy and well-being, allowing us to function the next day. Insomnia. It is acute or chronic, difficulty falling asleep, sleeping too lightly, frequent awakenings during the night, the inability to fall back to sleep once awakened, and waking up too early and unable to fall back asleep. With chronic insomnia, the person may become preoccupied with getting enough sleep. The more they try to sleep, the greater their sense of frustration and distress. Insomnia. 1/2 to 2/3 of elderly experience sleep disturbance. Multiple drug treatments may affect elderly sleep patterns. And everyday stress, anxiety, caffeine consumption, and alcohol are the biggest culprits. Sleep hygiene. The bed should be used for sleep and sexual activities only. If sleepless, get up until drowsy. Arise at the same time each day, and exercise every day, and keep the bedroom quiet, dark, and cool. Avoid daytime napping, and break the cycle of insomnia by staying awake for an entire night. Relaxation techniques can help improve sleep, such as abdominal or deep breathing, biofeedback, or imagery. Daytime sleepiness. Primary hypersomnia. Daytime sleepiness it's without explanation. Narcolepsy is an irresistible need for brief periods of sleep, common among close relatives. Breathing-related sleep disorders, such as obstructive sleep apnea. Narcolepsy and cataplexy. Narcolepsy is daytime naps that may occur with or without warning and may be physically irresistible. They are typically refreshing, but only for a few hours. Cataplexy is muscular weakness, which may range from a barely perceptible slackening of the facial muscles to the dropping of the jaw or head, weakness at the knees, or total collapse. Breathing-related sleep disorders. Sleep apnea is snoring then silence. It's a period of apnea when airway is blocked. They will suffer morning headaches, decreased mental functioning, and reduced sex drive. Repetitive cycles will lead to high blood pressure, MI, or stroke. Now, regardless of the type, the individual with sleep apnea is rarely aware of having difficulty breathing, even when awake. Sleep apnea is recognized as a problem by others witnessing the individual during episodes or suspected because of its effect on the body. Parasomnias. These are nightmares, exceedingly vivid, frightening dreams. Sleep terrors, awakened with scream and without recall of the dream. Sleepwalking, arising from sleep and walking in semi-conscious condition. Now, sleep terrors, when a child awakens terrified, they are in a state of clouded consciousness, often unable to recognize parents and familiar surroundings. They'll wake abruptly from a slow-wave sleep, and with waking usually accompanied by gasping, moaning, or screaming. And it is often impossible to fully awake the person, and after the episode, the subject normally settles back to sleep without waking. A night terror can occasionally be recalled by them. Visual hallucinations may occur too. Assessment. Assess for normal sleep patterns, and there is little data supporting the use of medications for long-term for treatment of insomnia. Nurse and diagnosis. Disturbed sleep pattern. Could use monitor for obstructive sleep apnea, looking for chronic fatigue, hypertension, multiple awakings throughout the night, snoring, and daytime sleepiness. Outcome identification. Hopefully with this, they will experience a restorative sleep and will describe falling asleep much more easily. Planning and interventions. Use a standard sleep hygiene protocol, guided relaxation, muscle therapy, massage, support and reassurance for nightmares, and referral for further assessment. Now, sleep diary could be used to help diagnose and measure improvements in sleep disorder. Should be entered in a sleep diary every night. Evaluation. Outcomes will be subjective. The sleep may not be directly observed, though. Bulimia nervosa. It is fasting, binging, and purging. Preoccupation with weight and body image. They'll have episodes of out-of-control eating, and they'll binge in secret. They may purge with laxative, diuretics, or vomiting, and affects more women than men. This is a psychological condition in which the subject engages in recurrent binge eating, followed by intentional purging. The purging is done in order to compensate for the excess intake of food, usually to prevent weight gain. Treatment is SSRIs, and Prozac is supported by strong evidence. Cognitive behavioral therapy can also be used since depression often complicates the bulimia, and there is a need to assess for self-harm ideations and a means for suicide. Anorexia nervosa. It's a profound disturbance in body image. They see themselves as fat even though they are emaciated. Profound physical effect on their body, have intense fear of gaining weight, and they will deny the seriousness of the problem. Treatment: psychotherapy, hospitalization, behavioral therapy, force feeding when necessary, cognitive behavioral therapy, which is shown to have really good success, and improved nutritional status. The first step in treatment of an anorexic is a nutritional rehab, and they need to have some rational limit setting. Assessment. The weight history shows a 15% or greater weight loss. Anorexia means loss of appetite. Anorexia nervosa is an eating disorder, an eating and purging experience. They'll identify motivation for treatment, and the difference between anorexia and bulimia is that bulimics are usually of normal weight. Nurse and diagnosis: imbalanced nutrition, less than body requirements, disturbed body image, self-concept disturbance, chronic low self-esteem, social isolation, and ineffective health maintenance. Outcome identification. Identify realistic outcomes, recognize chronic nature of the disease, focus on short-term outcomes, and watch for osteoporosis. As young adults, they are at risk for pathological fractures due to minimal calcium in the bones. And anorexia is a life-threatening condition that can put a serious strain on many of the body's organs and physiological resources. And it has one of the highest mortality rates of any psychiatric condition, with approximately 10% of people diagnosed with this condition eventually die due to related factors. Planning and interventions: 4 stages of treatment: nutritional rehab, psychotherapy, maintenance, follow-up care, and they do have to have rational limit setting. Evaluation. This is done on basis of stated outcomes. Remember, it is a very complex disease. They need to maintain one-on-one supervision of the patient during meals and for 1 hour afterward to ensure that they comply with the dietary treatment program. Sexual disorders. Sexuality is a part of human personality. Sexual history includes functioning thoughts, fantasies, behaviors, preferences. Sexuality is private and personal. There are 2 categories: disorders of sexual functionings and paraphilias. Disorders of sexual functioning is disorders of desire or premature ejaculation. The desire phase is marked by a strong urge for sexual stimulation and satisfaction, either by yourself or with another person. Now, premature ejaculation is characterized by a lack of voluntary control over the ejaculation. Paraphilias, thoughts and behaviors. Exhibitionism is that they exhibit naked parts of the body to another person. A fetishism, attractive sexual qualities to objects which are both inanimate and commonly considered non-sexual. Voyeurism, non-consensual rubbing against or touching another person in order to achieve sexual arousal or even orgasm. Pedophilia, sexually attracted to children. Paraphilias, thoughts and behaviors. Sexual masochism, the sexual pleasure or gratification of having pain or suffering inflicted upon self. Sexual sadism, sexual or social pleasure or gratification in the infliction of pain and suffering upon another person. Voyeurism, the practice of obtaining sexual gratification by looking at sexual objects or acts. Transvestic fetishism, any sexual behavior or arousal that is in any way connected to clothes of the other gender. Assessment. Identify if disorder exists. Make appropriate referrals and look for cultural and religious differences. Make sure to spend uninterrupted time with the patient. Encourage them to express their feelings in a non-judgmental manner. Explain that all treatments and procedures, and never say anything that would make the patient feel ashamed. Treating a patient with empathy does not threaten your own sexuality. Nurse and diagnosis. ineffective sexuality patterns, or altered sexuality patterns. Now, the best intervention for altered sex patterns is active listening. Outcome identification. Identify outcomes with the client and encourage patient to make decisions about their care. By encouraging a patient to make decisions, it will help to increase their self-esteem and increase their sense of mastery over the current condition. Planning and intervention. Most common intervention is listening. SSRI, like sertraline, is used off-label for its side effect to delay ejaculation. Now, sertraline is not just for depression. Evaluation. Most often they may be referred to another professional who specializes in dealing with sexual disorders.